Hello. If you clicked on this video, the title probably caught your eye, and I understand why. She will feel the difference instantly. Use this trick tonight. It sounds bold, maybe even a bit exaggerated, and my first commitment to you is honesty. Allow me to translate that headline into medical language, into our language. The trick I'm referring to is not a magic formula, but rather a technique of proprioception and body relaxation. The difference felt instantly refers to a possible improvement in your local sensitivity and, more importantly, in your ability to relax a specific muscle group, which is a fundamental prerequisite for a quality erection. It's not a guarantee of maximum instant rigidity for every man, but it is a fine-tuning, a physiological detail that can indeed make a noticeable difference on the very same night. I am Dr. Evelyn Reed. I completed my medical degree and then my residency and doctorate in urology at Johns Hopkins University. Seeking to understand men's health even more deeply, I did a fellowship in sexual medicine in Germany and participated in research on pelvic microcirculation. For over 15 years, I have dedicated my clinical practice to helping men, especially those who, like you, are over 60, understand that the quality of their sexual life depends on details that go far beyond a blue pill or any other color. My goal here today is to offer you practical, safe, and, above all, honest guidance without false promises. And to start, I need to tell you something that almost no one talks about, something that goes against what most men believe. The secret to a more efficient vascular response, that is, a firmer, more reliable erection, often doesn't lie in the intensity of the stimulus, the force of the touch, or the speed of the movements. On the contrary, it lies in the state of relaxation of your pelvic floor and the quality of your breathing minutes before any touch even happens. The vast majority of men, due to a completely understandable performance anxiety, do the exact opposite. They create counterproductive tension in the pelvis. Unconsciously, you might be tensing your abdomen, your buttocks, and the muscles between your anus and testicles. This tension acts like a clamp, a vice that tends to trap blood flow and hinder venous return, instead of releasing it to allow the magic of penile hydraulics to occur. Think of your body as a hydraulic system. A quality erection depends on two very simple things: that blood enters the penile arteries easily and, crucially, that it stays there long enough, with the exit veins gently compressed. It's a delicate balance. Now, imagine that your pelvic floor muscles, when tense, act like someone stepping hard on the water hose. They can compress the vessels, hindering both the inflow of blood and the mechanism that keeps it there. The result can be an erection that is slow to happen, doesn't achieve ideal rigidity, or is easily lost. This is where the most interesting part and the real trick comes in: your breath. When you breathe in a short, shallow way, using your chest as we do when we are anxious or in a hurry, you are activating the sympathetic nervous system, our fight or flight mode. This mode is terrible for intimacy. It releases adrenaline, constricts peripheral blood vessels, and diverts blood to the large muscles, preparing the body to run from danger, not for a moment of pleasure. On the other hand, diaphragmatic breathing, that slow, deep breath through the nose where you feel your belly rise and fall, does the exact opposite. It tends to activate the parasympathetic nervous system, which is the body's rest and restore mode. This is the system that runs the show. It is essential for the release of a precious molecule called nitric oxide in the walls of your blood vessels. Nitric oxide is like a switch that tells the arteries to relax and open up, allowing blood to flow freely where it needs to go. Therefore, by releasing this pelvic tension and breathing calmly and deeply, you are actually creating the perfect neurochemical and mechanical environment for an erection. You are taking your foot off the hose and turning on the faucet at the same time. And this is something you can start practicing tonight in your bed in less than 5 minutes. Let's build this together in layers as a simple habit. The first layer is about releasing tension from your lower back. Many men, especially after 60, accumulate stiffness in this area. And what few know is that the nerves that control erectile function pass through this region. A tense lower back can interfere with these nerve signals. So the first step is very simple. Lying on your back in bed, gently pull your knees toward your chest. Hug them without forcing, just enough to feel a gentle stretch in your lower back. Hold this for about 2 minutes. Breathe normally. The goal here is just to Decompress this area, create a little space, and relieve pressure on these important nerves. The second layer is activating your parasympathetic system through breathing. After releasing your knees, remain lying on your back with your legs bent and your feet flat on the bed. Place one of your hands on your belly just below your ribs. Now, we'll do 5 cycles of slow, deep breathing, only through the nose. Inhale through your nose for a slow count of 4, feeling the air fill your lungs and your hand rise with your abdomen. Hold the air for a second or 2 without tension, and then exhale slowly through your nose for a count of 6, feeling your belly gently fall. The focus is to feel the movement in your hand. This helps signal safety to your nervous system, telling it that everything is okay, there is no danger, and it can enter relaxation mode. The third and final layer is the fine-tuning, the active relaxation of the pelvic floor. During these same 5 breathing cycles, as you exhale slowly, bring your attention to the muscles between your anus and the base of your testicles, the perineum area. The intention here is not to contract. It's the opposite. Imagine you are releasing these muscles, letting them drop toward the mattress. It's a subtle mental command, almost like the feeling of relaxing your sphincter after urinating, but much more gentle. You don't need to force it, just have the intention to release. As you inhale, the muscles may naturally tense slightly. As you exhale, you consciously let them go. It is the combination of these 3 layers, decompressing the lower back, breathing with the diaphragm, and releasing the pelvic floor, that constitutes the technique. It is a ritual that prepares your body, that tunes your physiology for intimacy. An important note, men who suffer from chronic pelvic pain or have been diagnosed with pelvic floor hypertonicity should perform these movements extremely gently and ideally always with the approval of their doctor or pelvic physiotherapist. The intention is to relieve tension, not create more. I know that at this point, some objections may arise. The first might be, "Doctor, but this takes time." Actually, the entire sequence takes less than 5 minutes. That's less time than you take to brush your teeth. It can be done in bed as a transitional ritual between a busy day and a moment of intimacy. The second objection might be, "It seems complicated." I assure you it's not. It's just about breathing and letting go. Your goal isn't perfection on the first night. The goal is simply to bring your awareness to this area of your body, which is often completely ignored. With practice, this relaxation will become almost automatic. And the third and most common objection, "I already use medication like sildenafil or tadalafil. Do I need this?" It's great that you have a medical treatment that helps you. Think of this technique not as a competitor to the medication, but as its best partner. The drug works by dilating your blood vessels to facilitate blood flow. This technique tends to create the ideal body environment for the drug to work even better. You prepare the ground, relax the muscles that could be obstructing the flow, and the medication then has a clearer path to act. You are optimizing the process. Over my years in practice, I've seen how small habit changes can yield significant results. I remember Robert, a retired engineer from Austin who was 68. He came to me frustrated, saying that anxiety locked up his response even with medication. I suggested he practice this breathing and pelvic relaxation routine every night without the pressure of having intercourse. After a few weeks, he returned to the clinic with a different demeanor. He reported that his morning erections, which had become rare, seemed to return with more firmness, and that during moments of intimacy he felt less rushed, more present. Or the case of James, from Portland, 72 years old, a regular tadalafil user. He complained that sometimes the response to stimulation took a long time to happen. By incorporating the pelvic relaxation exercises minutes beforehand, he noticed that the response to stimulus seemed quicker and, in his words, the erection felt fuller, more complete. These are anecdotal reports, of course, but they illustrate an important physiological principle. I want to be very clear with you about the science behind this. The connection between pelvic floor relaxation, the activation of the parasympathetic nervous system, and the improvement of erectile function is a pillar of pelvic physiotherapy and sexual medicine. It is physiologically plausible and well established. Although there are no large, randomized, double-blind clinical trials on this specific 3-step sequence I have described, it is based on principles we have known and applied for decades. The results are, and always will be, individual. Every man's body is a universe. Therefore, this guidance is strictly educational and never, under any circumstances, replaces a complete medical evaluation to investigate the causes of your erectile dysfunction, which can be multiple, involving vascular, hormonal, neurological, and psychological issues. It is crucial that you understand the common mistakes that can sabotage not only this technique, but your sexual function as a whole. The first mistake is focusing only on genital stimulation while ignoring the state of tension in the rest of the body. The penis is not an isolated organ. It is the end result of an orchestra that involves your brain, nerves, hormones, and circulatory system. The second mistake is holding your breath or breathing shallowly from the chest during arousal. This, as we've seen, activates the alert system and works against you. The third mistake is tensing the pelvic muscles, abdomen, and buttocks due to performance anxiety, exactly what we are trying to reverse. And the fourth, perhaps most important, is trying to rush the process, forcing a response instead of allowing your physiology, now in a state of relaxation, to happen at its own pace. Sexual life after 60 gains in quality when presence replaces pressure. Consistency is more important than intensity. Incorporating this small 5-minute practice isn't about having a perfect performance tonight, but about re-educating your body and mind for the long term. It's about reclaiming confidence in your own physiology. It's about understanding that you have internal tools beyond the pharmacy to actively participate in your sexual health. Your body remembers how to respond. Sometimes it just needs the right signal, the right environment of safety and relaxation to express itself. Your journey to a more satisfying, intimate life doesn't have to be a lonely struggle or a path of frustration. It can be a process of self-discovery, of kindness to yourself, and of relearning how to communicate with your own body. Before we finish, my responsibility as a physician requires me to leave some very clear safety warnings. This content is educational. It does not replace a medical consultation. If, during the practice of these exercises or during sexual intercourse, you feel sharp pain in your pelvis, back, or penis, stop immediately and talk to your urologist. Men with a history of prostate surgery, a diagnosis of chronic pelvic pain, or the presence of inguinal or abdominal hernias must have explicit professional authorization before starting any type of pelvic exercise. And please be aware of the warning signs. A sudden and severe onset of erectile dysfunction, especially if associated with chest pain, shortness of breath, or palpitations, requires an emergency medical evaluation, as it could be a sign of an underlying cardiovascular problem. Likewise, testicular pain, blood in the urine or semen, or any change from your normal state must be investigated by a specialist. Now, so I can know if our conversation made sense to you, I'd like to ask something simple. If this guidance was helpful, comment below with the number 1. If you found it unclear or unhelpful, comment with the number 0. Your feedback is very important to me. Feel free to also tell me which city you're watching from. I love to see how far our conversation reaches. And if you believe this content could help a friend, a brother, or an acquaintance, please share this video. Quality, taboo-free information is a powerful health tool. Take care of yourself. And remember, your health and your well-being are in your hands.